My name is Darren Kies. I'm an interventional radiologist. I'm the chief of interventional radiology for a private practice group called Piedmont South Imaging, and we provide services to Piedmont Fayette Hospital and Piedmont Noonan Hospital in the south and southwest metropolitan area of Atlanta. An endobronchial biopsy is a minimally invasive procedure typically performed by a pulmonologist who is a physician that specializes in lung disease. It involves placing a very thin camera called an endoscope, either through the mouth or through the nose, into the upper airway and into the smaller airways of the lungs. Sometimes the tumor is actually located inside these airways, and a special grasping device can be utilized to achieve fragments of the tumor or mass or whatever's being sampled. And that is one type of endobronchial biopsy. Sometimes the tumor is immediately adjacent to the airways within the lungs, and sometimes that tumor happens to be a lymph node in the mediastinum. In those cases, this endoscope can be fitted with an ultrasound as well to visualize these structures that are immediately adjacent to the airways. And then the device also has a port where a very thin needle can be placed along the trajectory of the ultrasound, so the tip of the needle is visualized, sampling tissue from whatever the adjacent mass or lymph node may be. And that's called a fine needle aspiration. Basically, it's a different type of biopsy where the cells are collected in a very thin needle, and they're small fragments of cells instead of a large piece of tissue, but they're also usually satisfactory for the diagnosis of lung cancer. Sometimes the target for lung biopsy under endoscopy are lymph nodes in the mediastinum. The mediastinum is the central portion of your chest that contains the heart and many of the great vessels coming out of the heart. It also contains the central airways of the lungs. And there's also a large array and network of lymph tissue and lymph nodes that cancer can drain into. And sometimes these are enlarged and are the anticipated target for an endobronchial biopsy or fine needle aspiration.